Hi, I'm Suzanne Clegg, and I'd like to tell you about how I work with diabetes. I like to work with diabetes on the physical level with like insulin and insulin resistance and lab tests and hemoglobin A1C and all that, just because that's the level of accountability. That's sort of like the definition of diabetes, is that physical measurement stuff. The next level I like to work with diabetes is the what I call my octave of life force. When your blood sugar is going haywire, you don't feel good. You usually get tired, lethargic, you just don't feel right. And that's one of the usually like if you've known somebody who's like had their blood sugar really super high and then suddenly got it under control, they say how much energy they have. So we want to work with just your life force. And to do that, I might work with acupuncture. I might use tuning forks. I'm going to show you in a minute how I use the tuning forks. I might work with diet, definitely would work with diet and plants. And there's other things that we can use with the life force. The next level that I would work with diabetes is the octave of emotions and images. And there's not like a certain emotion that goes with diabetes, but there are emotions that go with your diabetes. So that you will have emotional responses to having this diagnosis, to having to be careful with what you eat. There will be emotions. Some of the emotions that I tend to look for are taking care of others, not yourself, and what is sweetness in your life, and what does it mean to want the sweetness, eat it anyway. That whole relationship with sugar and sweetness is diabetes at a higher level, at the emotional level. And then the next level I like to work with, I call it my octave of higher vibrations. I would call it, or the spiritual level, is what is the meaning of diabetes in your life? What does it mean that you have to take care of yourself in a different way now? What does it mean that that you might be having difficulties with parts of your body? And how can you respond to that? Because sometimes when we get the meaning clear, there's like a ripple effect, and suddenly we're able to feel better about the sweetness or lack of sweetness in our life. We're able to take care of ourselves so that we eat the right foods and can feel that vitality. And then we get those good blood tests and we celebrate. Anyway, so now I'm going to take you into my office where I'm going to show you how I can use tuning forks on acupuncture points, so that instead of needling the acupuncture points, we can just put sound on the acupuncture points, and that way we can lower your blood sugar, or just, it lowers it if it's high. It doesn't like lower it if it's already okay. It modulates it, makes it regular. But you should be cautious if you're on insulin, because it's sort of like exercising. If you're on insulin and you suddenly exercise more than you're used to, you might need to change the amount of insulin you're on. And the same thing works with this. It's not that anything bad's happening to you. It's sort of like exercise in the way that you would control your medication dose. But what's really great about that is you might not need as much medication. So this is a way to really lower your insulin usage, or if you're on oral hypoglycemic agents, or just trying to control your diabetes with diet and exercise, it might be a whole lot easier with tuning forks. All right, so let's go in the other room. And the PV has volunteered to let me show you how I use tuning forks on acupuncture points to help with diabetes. Very simple. I just activate the forks, and I put these are actually buzzing now, and you can't really hear them, but they are making a sound, and the sound is going into her body. So instead of activating the acupuncture point with a needle, I'm putting a tuning fork on it. And you can see it. I can do it right through her clothing. Very good. Now that's the point called spleen 6. Now I'm going to go to kidney 3. Another really good point for diabetes. This is so powerful that your blood sugar can go down, and you might require less insulin, so just be aware of that. It usually doesn't make your blood sugar go down if you aren't diabetic. It doesn't lower it too much. It's not strong enough to do that. And now I come over here with this, and now over here, and one other point here, stomach 36. All right. And that's the tuning forks for diabetes.